Hi guys, we're going to talk about the inferior alveolar nerve block. So first, for the nerve anesthetized, we have inferior alveolar nerve, incisive nerve, mental nerve, and lingual nerve. For the area anesthetized, we have anterior two-thirds of the tongue, lingual soft tissues, buccal mucoperiosteum, mandibular teeth to the midline, and the inferior portion of the ramus. So, for the landmarks, we have the coronoid notch, external oblique ridge, internal oblique ridge, pterygomandibular space, and the retromolar triangle. So for the depth, we have 20 to 25 millimeters. And then for the deposition, we have 1.5 ml or 2/3 or 3/4 of the needle over 60 seconds.
Hi guys, for the inferior alveolar nerve block, you'll need the following armamentarium. You're going to need a sterilized mouth mirror, explorer, cotton pliers, saliva ejector, cotton swab, sterilized gauze, sterilized and prepared cotton balls. You'll need a syringe, one 27 gauge long needle, local anesthetic solution. Clinician will need gloves, 2 Dapin dishes, one for your anesthetic and one for the topical anesthetic solution. Topical anesthetic solution or gel, antiseptic, and waste receiver.
So, how to load your cartridge to your dental syringe? Make sure first that your syringe is an aspirating syringe. So, we're going to put our dental cartridge and engage. Yeah. And then, we're going to put our needle. Before injecting to the patient, we need to make sure that there's no bubble in the cartridge. To remove the bubbles, just tap there. So, remember, in recapping, we should use scoop technique. Okay, so let's get started. Sir, can you kindly face me, please, and open your mouth. So, let's start with the tissue preparation. First, we're going to dry the tissue with the use of sterile dry gauze. So, retract the tissue to make it taut and dry. Then, apply antiseptic. And after, we're going to apply topical anesthesia. We're going to need a cotton and leave it there. Close your mouth, sir. So, please open your mouth. So, we're going to remove the cotton that we left a while ago. So now, we're going to palpate the landmark. From the ascending ramus of the anterior border of the mouth, of the mandible, we're going to palpate the deepest notch, which is the coronoid notch. And after palpating, go medially to palpate the internal oblique ridge. And then retract the tissue until you go back to the coronoid notch. So if you can find the landmark, which is the pterygomandibular triangle, repeat the procedure. So, as you see there, the pterygomandibular triangle, we're going to get the dental syringe. So, to start, let's palpate again the landmark. After palpating, make sure the tissue is taut. Then aspirate. Make sure it is negative. And then deposit. So, sundan mo lang to. So, make the needle safe. Remember, use scoop technique.